Hello and welcome once again. We are going to be speaking about Hysterosalpingography, otherwise known as HSG. Have you watched our previous educative and amazing topics? If you haven't, kindly watch them on our Facebook page. Hysterosalpingography is one of these common compound words that we use in medicine. Hystero comes from the Greek word uterus and salpingo comes from the Greek word tube. So we are looking at the uterus and the tube. Our objective today will be the indication of contradictions for HSG and to understand the basic techniques for the procedure. We would also look at the basic anatomy as seen on X-ray or fluoroscopy during an HSG and identify some common normal and abnormal findings of the procedure. This is a picture of a normal HSG and it gives the opportunity to review the pelvic anatomy as seen on an imaging. Remember that an HSG is a minimum basic diagnostic requirement in which we inject radiopeptide into the uterus very gently and take pictures in real time with fluoroscopy or statically on X-ray to diagnose abnormalities of the female upper genital tract. The first time we see is the catheter in the lower uterus. Next, we see the uterus. This uterus has a normal shape and a contour. Finally, we are going to look at the fallopian tubes. Fallopian tube have three parts. You can see the skinny portion. That's the part that's closest to the uterus. The fallopian tubes then gets wider in diameter. That's the ancula and the very end of the fallopian tube. This is the femoral, which is a little bit difficult to see in the films. Indications for this procedure includes infertility, recurrent pregnancy loss, and suspected congenital uterine anomalies. Sometimes we also do HSGs for localization of fibroids, pre-upper evaluation of tubal renal sources. The most important contradictions are history of an active recent pelvic infection, active vaginal bleeding or current pregnancy. It is also a very important thing to know whether the patient has any allergies to contrast dye and to confirm if the patient is not pregnant nor bleeding, and after obtaining a form of consent, the patient is placed into lateral position and a spectrum is placed into the vagina. You can see a picture of the woman's cervix. The cervix will then be swabbed with tetherdyne and a catheter or cannula will gently be placed into the cervix or into the uterus. You can also see a catheter and you can also see a cannula that will be used during the procedure. The other instrument that includes is a single tooth canaculum, which can be used to grasp the cervix to help with positioning. Once the catheter or cannula is placed, warmed radiopeptide is gently injected into the uterus under the fluoroscopic dyes. In a normal case, dye is observed entering the uteral cavity and the shape or contour is noted. Dye is then observed entering the fallopian tubes and hopefully exiting the femoral end or tubes. This is another image of a normal hysterosalpingograph. First, take note of the single tooth canaculum and cannula in the lower uteral segment. Next, we can also see the uterus and the isthmic portion of the fallopian tubes. We can also see the tubes are getting a little bit wider. That's the ancula, and finally, particularly on the right side, you can see the crescent-shaped areas of the dye. This is the dye freely spilling from the fallopian tubes and wrapping itself around the bowl, giving us the classic crescent shape. Here is another normal HSG. You can see that the dye has spilled from both fallopian tubes. There are two findings on the HSG. In this case, that are instant to look at. The first step is the top of the uterus. There is a slightly different shape that we have seen before, but this will be considered a normal variance. Second, we see an area of isthmic portion. That's a sign of a condition called the secunditis isthmical nodosum or SIN that has been associated with infertility or subfertility. Here is an image of an HSG with a lot going on. First, we see that the uterus is deviant towards the person's right side or towards your left side. We also don't see any dye going into the fallopian tubes, but most importantly, we see an area of the uterus which no dye is seen. This represents an internodal fibroid. Here you can see an abnormal HSG. we are just going to focus on the uterus, and you can see that it almost looks like bunnies. This represents a congenital uteral anomaly, and it could either be a septum or biconial uterus. It is important to remember that you can't tell the distinction between these two on HSG, but we do know that septums are 10 times more common than biconial uterus. This woman has a double uterus or uterus diadelvis. That's complete duplication of the uterus and the cervix. She has what looks like a two-chambered uterus, which is correct, but you can look at the bottom of the screen. You can see that she has two separate cervixes as identified by these two uteral segments. This is an unusual congenital uteral anomaly. Here, we see a patient who has bilateral postmultiplication as identified by the arrows. The uterus is in normal shape and the contour, but no dye is seen getting into the fallopian tubes. Our last image is of a woman who has a pelvic inflammatory disease and now has bilateral hydrosalpinx, as seen by the very large dilation of the ancillary portions of the fallopian tube on each side. This is a common case of tubular infertility. In summary, we have taken few minutes to define the indications and contradictions of HSG and given you a basic understanding of the techniques and the procedures. We have looked at some normal anatomy and looked at some common and uncommon abnormalities of the uterus and the fallopian tubes. Thank you for watching. See you next time. If you have any further inquiries, kindly contact us. Thank you.